Hello YouTube, it's me, the Atheist Advocate. I come here with a message about this healthcare debate. The public option, which Obama preaches will help our nation, is getting a lot of criticism from the conservative crowd. Oh, wow, hard to imagine that conservatives are disagreeing with anything a liberal is saying in the office. But back onto the point of healthcare. The public option would increase taxes, of course, most likely. It would create socialized medicine, which means taxpayer dollars are put to help those who do not have the money to afford the outrageous fees asked for by private insurance companies. The public option will also give the private insurers a little bit of competition, which they really don't have right now. So, basically, they're finding problems with the public option because people who already have private insurance are going to be, I guess you could say, on a level playing field with those who have to get the public option because they can't afford private insurance as of now. So I guess they just don't want equality. But then again, they did work. They worked for what they had. But the thing I can't understand is you still need, no matter how high up you get, there's always going to have to be somebody below you. The minimum wage people, yeah, they're probably there because I made a mistake, but they're so necessary to fucking society. No matter how many people want to be rich, not everybody is going to be rich. So we might as well help out those who are at the bottom, don't you think? It's just kind of, I don't know, humane. It shows a little thing called, genuine kindness. Not like these people who just give to charities to get the tax, get the tax breaks. But those people who just give to charity, I just think charity should be something you give out of your heart, not really to get a tax break. But, some people may disagree with me. Back onto the healthcare issue. It kind of strikes close to home with me, mostly because my mother and my sister do not have, private insurance because they can't afford it. They also do not qualify for Medicaid or Medicare, which pretty much means they're fucked if something goes wrong, which is kind of going wrong. My mom, as of now, has tingling in her left arm, which is the first signs of a heart attack. My sister, on the other hand, is showing signs of colon cancer. Fun, fun, fun. But here's the thing that conservatives always tell you. Well, if somebody's dying, they can go to the hospital. The hospital has to treat them. It's just the taxpayers have to pay more. They're still complaining. You're still fucking complaining because the hospital has to keep somebody alive, but the taxpayers have to pay for it in some way, form, or fashion. They have to pay because then the rates of the hospital go up. Oh, dear fucking Lord, people. You're saving somebody's goddamn life. Have a little thing called humanity. But no, these conservatives lack that. They don't have this thing called humanity. They're greedy bastards. So, my sister, by the way, think about the hospital. If you have signs of a deadly ailment, they won't treat you for free. They won't treat you. Now, if those signs of a deadly ailment turn into the deadly ailment and you're lying on a deathbed way too late for treatment of your illness, then yes, the hospital will keep you comfortable while you slowly die. So, back onto my sister. She's showing early signs of colon cancer. She's a college student. Of course she doesn't have money for private insurance. My mother doesn't have money for private insurance, so therefore my sister can't get it. So, what is she to do? She works. She can't afford a colonoscopy. Are you fucking kidding me? Those things are thousands of dollars. There's no public option to help her with this. What's going to happen to her if it actually is colon cancer? Well, if it is colon cancer, she's going to go into very advanced colon cancer. And by the time she gets to the point where she's actually admitted to a hospital for showing signs of near death, the hospital won't be able to do anything because it'll be too late. Thank you, conservatives. Because of you, my sister, who never even had a chance to make anything of herself. She's going to college, mind you. She's going to work for her future. She works a job and goes to night classes. So she is working her way up the ladder. It's just, it happened a little too soon for you bastards. And now my mom is a little different. She never worked. Well, she works her ass off, mind you. She works 12-hour shifts a day, 5 days a week. She works at least 60 hours a week to make ends meet. My father, on the other hand, here's a little backstory of my life. My dad is upper middle class. My mother is pretty much lower class. She's barely middle class because of my stepfather. So I've kind of seen both sides of the spectrum. My dad has a hobby. It's called clock building. He builds clocks, and as a hobby, money is not an issue for him. I'm not talking bad about my dad. My dad's a very good person. But I'm just saying I've seen both ends of the spectrum here. My mom, her hobby is working, cleaning, doing that kind of stuff. That's her hobby. She doesn't have time to do anything else. She works 8 in the morning till 8 in the evening. So, I mean, I've seen both ends of the spectrum here. I've seen my dad has insurance. I have insurance because of my dad. My mom doesn't have insurance. So I'm kind of lucky, but I also have to watch my mom fall apart. Like, I've seen she cracked a tooth, but she doesn't have money to get it fixed. So it's bad. I've seen both ends of the spectrum here. So, I mean, I know where my dad, he's conservative. I know where my dad's coming from when he says, oh, I don't want more taxes. I don't want to have to take the public option. I like my private insurance. But at the same time, conservatives need to realize that there are people who don't have they don't have enough money to afford private insurance. They don't have an employer that offers them insurance, private insurance. So what are they going to do? They don't qualify for Medicare. And I've just brought up 2 examples. My mom is showing early signs of a heart attack. She can't go to the doctor. She can't afford it. I wish I could afford to pay her, but I work minimum wage. So I can't do anything for my mom. She's just going to have to sit there. And then if one day it gets too bad, if she has a massive heart attack, they will rush her to the hospital. And I really hope that she survives. But with today's healthcare option, she cannot afford to get the screening done to make sure that she doesn't have the early signs of a heart attack. Same with my sister with her possible colon cancer. So this is just a message to conservatives in Washington and, just conservatives in general. If you don't agree with the healthcare system, just try to think about it from somebody else's perspective and stop being a fucking pig. This is the Atheist Advocate giving you a nice little message about some politics.